Hi, I'm Dr. Azmi Mohsen, Professor of Anatomy. I welcome you all to my YouTube channel, Dr. Sam's Anatomy Classes. Here I'm going to solve this Anatomy Paper 2 of MBBS First Professional Exam of students admitted in MBBS 2019 batch at GSVM, that is Ganesh Shankar Vidyarthi Memorial Medical College, Kanpur. And this college, is affiliated to CSJM, that is Chhatrapati Shahuji Maharaj University, Kanpur, UP. Okay, this exam was conducted on 28th of January 2021. So, as you know, according to the new MCI GMER regulations, this pattern of examination a little bit changed from 2019 batch, and this is going to continue further. So this question paper is uh, of 3 hours and 100 marks question. You can see there was this long question of 10 marks, right? Okay, on stomach. Then there are short questions, 20 marks, diagrams of 20 marks, then short notes again 20 marks, and enumerate type of questions, they are also 20 marks. And now they find MCQs. They are 5 MCQs of 2 marks each. That makes it 10 marks question. So I'm going to solve these MCQs for you. So keep listening carefully. I'm going to explain them so that it helps you in your further exams. Those who are freshers, it will help them for the exams ahead and even for your NEET PG purposes also. Keep listening. Okay, so now we'll start with this question number 1 that states that branches of femoral artery are all except profunda femoral artery, deep circumflex iliac artery, superficial epigastric artery, descending genicular artery. For this, you have to just keep a revision. I mean, what I'm telling is just to remind you of femoral artery. So remember, this is ASIS, and this is pubic tubercle, pubic crest, pubic symphysis, right? And here you have is the inguinal ligament, right? Now you must be knowing that what is mid-inguinal point, right? So there's this artery, right? I'm drawing it in double lines so you can presume that this is artery, right? So this artery, when it enters into this thigh after crossing to this point, right? I shouldn't draw it like this. Okay, this, hold on. So now keep listening. This you're seeing is a thigh with this ASIS, pubic tubercle, pubic symphysis, pubic crest, right? And here you have is the inguinal ligament, right? Which is the folding of the lower edge of the aponeurosis of external abdominis muscle. Then, this mid-inguinal point, it's here this external iliac artery continues down as femoral artery below to this point called mid-inguinal point. This point is mid-inguinal point. Mid-inguinal point. One more thing, remember there was this another point a little lateral to the artery. This will be little lateral, and I think I should use this point. This point here is mid-inguinal midpoint of inguinal ligament. So there's a difference. Midpoint of inguinal ligament is from basically, what is the difference? Like, if you talk about the 2 points, and both of them have this significance. So inguinal ligament is actually from ASIS till pubic tubercle. This is pubic tubercle. This is ASIS, right? And what is inguinum? Inguinum is actually the fold, the crease created when your front of thigh touches the front of abdomen. That is like in its squatting position. So the fold created is called inguinum. So inguinum actually is from ASI. Is the lateral point is common for both, but the medial point is like till pubic symphysis. So remember that this because it extends more medially, the fold, the crease. So mid-inguinal point will be a little medial, it's like around half centimeter, medial to the midpoint of inguinal ligament, which is the lateral point. So, okay. So what will be the significance of mid-inguinal point? Remember, you have seen here in the diagram that it's the external iliac artery. It is this external iliac artery that continues as femoral artery by crossing to this below to this midpoint of mid-inguinal point. Okay. Another significance about this point is that there is this vertical line coming right from above. From where is it coming down? Remember the points, it's coming down from, yes, it's coming from the mid of clavicle. So it is the mid clavicular line. Then where does it crosses? The next destination is the nipples, right? So it crosses the nipples, and the next point that it meets is, yes, it is the tip of ninth costal cartilage. Ninth costal cartilage. And the fourth point is here. So these are the four destinations where this line, mid clavicular line passes through. Okay. Then of course, if you trace it down at this point, it's easy to palpate, and this point here you can palpate easily for the femoral pulsations. Then lateral to that, a little lateral to that will be the point here, that is midpoint of inguinal ligament. What is the significance of this? That here, just a little 1.5, 1.2 centimeter above to the midpoint of inguinal ligament, you find is an oval opening of deep inguinal ligament. So that is another significance, like 1.2 centimeter above the midpoint of inguinal ligament, you find is the deep inguinal ligament. That is like an opening, rather not an opening, but an extension, right, into the this fascia transversalis, right? So from where this peritoneum, fold of peritoneum comes, as a funicular processus vaginalis along to the spermatic cord. Okay, and what else? Yes, another important point here is the femoral nerve. Femoral nerve crosses below to this point called midpoint of inguinal ligament, right? So in case of like when you have to give a femoral nerve block, this also I'm telling apart from the question, but because it's the topic, it's relevant, so I'm just telling you for your questions further. Like how to give a femoral block. So remember when you palpate femoral artery pulsations with your index finger here and you place your thumb like this, right? So this is how when you're palpating for the, with your index finger, tip of the index finger, placing at the mid-inguinal point, then in the gap between the index and the thumb, right? In the gap between index and the thumb, it is here that you will approach for what? Yes, it is here that you will give the local anesthesia for femoral nerve block. Okay, local anesthesia, so you can block this femoral nerve at this point. So these were some interesting points which I felt like covering up. Yes, still there remains some point with the same diagram. Let me cover them also. So it's this point, this mid-inguinal point, it is the lateral most, and remember here this, pubic tubercle, which pubic tubercle actually continues here as the pubic pectinate line, and onto the pectinate line there is this ligament, that is lacunar ligament attached. So lacunar ligaments from the medial wall of this ring, right? What forms the posterior wall of, actually, this is a sheath, this is a sheath, right? A sheath type of thing, like, and the weakness in the anterior abdominal wall. So posteriorly it is, this sheath is actually called femoral sheath. Posteriorly it is formed by, you know posteriorly it is formed by fascia iliaca, while the anterior wall of this femoral sheath is formed by what? Yes, it is fascia transversalis. And the meat, and this sheath, and at its superior margin, that the rim is called the, this rim is called the ring, femoral ring. And what forms the medial wall of this femoral ring? It is lacunar ligament. Lacunar ligament forms the medial wall of this femoral ring. So this sheath is femoral sheath. Now, this sheath is divided into three compartments. So, it is this artery, the femoral artery, which is descending through the lateral compartment of the femoral sheath. What passes to the middle compartment? It will be the femoral vein that passes through the middle compartment of the femoral sheath. What lies here in the middle compartment? The middle compartment itself is called the femoral canal, right? So to this femoral canal you find is the deep inguinal lymph node, and this is called lymph node of Rosenmuller or lymph node of Cloquet, right? What is drained here? Remember, it is the glands of the clitoris that is drained here, the lymphatics from glands and clitoris. Then, uh, yes, so one another structure is that is the femoral branch of genitofemoral nerve. Femoral branch of genitofemoral nerve. This is femoral branch of genitofemoral nerve. That also passes through the lateral compartment of the femoral sheath, but it pierces this sheath and becomes, superficial to supply the skin overlying the femoral triangle. I hope you have understood. That was just a revision. Now I'll just rub it to come back to the topic, what I have to explain, and that is about the branches of femoral artery. That's just for a revision. I know that most of you must be knowing the answer, so why not, like, there's no harm in just revising it. So here I am to show you the femoral artery and its courses and its branches. So this is the thigh, as I was mentioning it. ASI is pubic tubercle, pubic crest, pubic symphysis, and here it is this inguinal ligament, right? Now you are seeing this. This is external eyelid, continues as femoral artery, right? And then femoral artery has an, medial course. It twists to become medial in its course, and then further it has this course like this. It reaches to the back of leg in the popliteal fossa. Now, here you seeing is another thing, and there it is called the adductor canal. So in the middle one third of the thigh, on the medial side, you find is this canal called the adductor canal, and this is the femoral triangle. So let's talk about the branches before wasting much time. There, this is external iliac artery. Now, before external iliac artery becomes the femoral artery, now this will be called femoral artery after crossing the mid-inguinal point. So, external iliac artery gives its branch deep inside and before crossing the inguinal ligament, and that is called deep circumflex iliac iliac artery, and a branch that ascends above towards the umbilicus, and this is called inferior epigastric artery, right? And there's a branch from inferior epigastric artery. Remember one thing, what important structure I told you was this. Here somewhere you find is the deep inguinal ring, right? It's a deep inguinal ring, lateral to the origin of inferior epigastric artery. Now, there's a branch from inferior epigastric artery that will reach into this inguinal, deep inguinal ring and will run along the spermatic cord, right? And will run along with the spermatic cord and will reach into the scrotum. Can you guess which artery is this? Branch of inferior epigastric artery continuing, running within this spermatic cord. What artery is this? This is artery to cremaster. Okay. So keep remembering the branches still yet I haven't started about the femoral artery, right? Now, after intruding into this femoral triangle, femoral artery gives its largest and longest branch of femoral artery, which will be that. What will be that? So the largest and longest branch of femoral artery is given out around 2.5 centimeter below to this mid-inguinal point, and it's given out laterally. And when it descends down, now it gives its two transverse branches, and itself continues down here like this, right? And it continues to run. Now, what I'm telling is about the course of this branch. What is this branch? This is profunda femoral artery. Yes. Okay. So it is, now running. Remember, it will descend down because it's not symmetrical. There is less of space. You have to keep understanding what I'm telling. The course will be like this. So this profunda femoral artery will now reach towards the medial side and will descend between the two muscles. Which two muscles? The gap between the two muscles that provides the passage for this profunda femoral artery to enter the medial compartment. Which two muscles are these? So the answer will be, what will be the answer? Answer is that this is pectineus, and this is adductor longus. And then further in its course, or when it reaches into the medial compartment, then this artery will give its four perforating branches, right? The four perforating branches, one, and to make you remember this also, it will be easier to remember. Then the key muscle, what is the key muscle of the medial compartment of thigh? Remember, it is this muscle called the key muscle of the medial compartment of thigh, and this muscle is what muscle? This is adductor brevis. So to help you remember the branches, the four perforators. The first perforator of profunda femoral reaches into the medial compartment, running above to the upper border of adductor brevis. the second perforator will actually perforate this adductor brevis. And of course, there will be, adductor magnus, then there will be, other, this vast, this vastus lateralis. And of course, down below there will be other muscles like the shorter of bicep femoris and all the structures which are actually attached to the linea aspera. They're being perforated here in its course. The third perforator now runs below to the lower edge of adductor brevis. This is how you can remember. The fourth perforator at an equidistance will now, that will be actually the termination of profunda femoral artery, and also it will perforate the aponeurosis of you know adductor magnus, shorter bicep femoris, and will reach and and drain into this vastus lateralis. So all these four perforators, remember, these are the four perforators of adductor, profunda femoral artery. They all will perfuse and bury themselves into the substance of which muscle? Vastus lateralis. So if in its case, if it's asked which muscle in the thigh is richly perfused, the answer is vastus lateralis. If it's asked, next question, which is the bulkiest muscle of the thigh? Your answer will be vastus lateralis, right? Which muscle is the selected muscle, most commonly used muscle for self intramuscular injections? The answer is vastus lateralis. So that was about this profunda femoral artery. Now we're back to femoral artery. So femoral artery, we were talking about the branches. One you have seen, the largest and longest branches, profunda femoral artery. Now there will be branches from this artery which actually, they come out through this opening. There is this, cribriform fascia, the saphenous opening, all this, if you remember. There was this weakness 2.5 centimeter below and lateral to the pubic tubercle. You find here is the weakening in the fascia lata, and that is called cribriform opening. Got it? So this branch will actually, this will emerge out through this cribriform fascia and will now take a course laterally, below to the inguinal ligament, but this is called superficial circumflex iliac artery. So remember, the superficial circumflex iliac artery is a branch of femoral artery. Deep circumflex iliac artery is a branch of external iliac artery. Then there will be another branch here which will emerge from cribriform fascia, and that also will run towards the umbilicus, but within the superficial fascia. So this will be called superficial inferior epigastric artery, right? Then there will be another branch which will emerge out from the cribriform fascia and will run medially into this thigh and will reach to supply the genitalia. This artery is superficial external pudendal artery, right? Then these are the three branches which are given out as subcutaneous branches. But deep inside, below to this fascia lata, it gives another branch which also runs medially, right? And which is reaching deep to supply the genitalia. Now, this artery, which is like not coming out from the cribriform fascia, running medially into the thigh and reaching to the genitalia. Now, this is deep external pudendal artery, right? So the both superficial and deep external pudendal artery are branches of femoral artery. Now tell me about internal pudendal artery. Internal pudendal artery is a branch of, yes, anterior division of internal iliac. Now about the two arteries, like हिंदी में कहते हैं चिमटा, एक चिमटे की तरह से दो arteries होती हैं, right? चिमटे से. What is like clammed? What is clammed between the two arteries, superficial and external pudendal artery? This is another question. If they ask, what is this structure? What is this structure that these two arteries clamp? This structure is clamped between superficial external pudendal and inferior external pudendal. Which structure is this? It's another question, MCQ. So this is spermatic cord. Spermatic cord. Remember that the spermatic cord is clamped in between the two external and superficial and deep external pudendal arteries. Okay. Now talking about the branches, yes, pudendal artery, the two branches, the transverse branches, I forgot to mention, this one here is medial circumflex femoral artery, and this one is lateral circumflex femoral artery. Got it? And these two arteries, lateral circumflex femoral artery, medial circumflex femoral artery, and there will be a branch coming from above, right? I should use this again. Let me rub them. So important point about these arteries is when they'll reach back of thigh, both of them actually winding around the thigh and will reach into the back of thigh. What will happen? It's there, this artery reaching from both the sides. So this is lateral circumflex femoral artery, and this is medial circumflex femoral artery. There is a branch coming from above, descending down. That is a descending branch of inferior gluteal artery. And remember now the first perforator. I told you about this first perforator running above this, adductor brevis. Now this is the, ascending branch of first perforator, right? Of profunda femoral artery. Oh, 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 oh. Sorry. I think I should use a little above. I think it's visible now. So you've seen that these two lateral and medial circumflex femoral arteries and descending branch from inferior gluteal artery and an ascending branch from perforator, the first perforator of profunda femoral artery. What are they going to form there? They're going to form a cruciform thing, right? Cruciform thing. This cruciform thing in the back of thigh is called cruciform anastomosis. Cruciform anastomosis at the back of thigh. Got it? Now the four branches forming this. Any special point if you know about the second perforator of profunda femoral artery? Any guesses? Anybody? Yes, first perforator, I have already told you about this first perforator. Now, what you know about the second perforator? Remember that the second perforator of profunda femoral artery gives a nutritional branch to femur. So now you got to know the blood supply of femur. The blood supply of femur is through the profunda femoral artery and via its second perforator. That gives a nutritional branch. By the way, now again tell me, this nutritional artery in femur will be directed downwards or upwards. The nutritional foramen in femur will be directed downwards, like distally, or it will be running upwards proximally. Think about fast. If you know the growing end, you can guess the artery, or if you know the mnemonic. So remember that the growing end of femur is the distal end. So this artery will be running opposite to the growing end. So remember that this artery runs towards the upper end of femur. Or if you remember the formula, towards the elbow we go, from the knee we flee. That was another mnemonic for the direction of nutritional arteries. Okay, yes, last but not the least, I need not mention the muscular arteries, of course. This is an artery of the main artery, the chief artery of the front of thigh. So it will supply, giving out its muscular branches in its triangle, femoral triangle, and even into this adductor canal. It will supply blood to this vastus medialis, sartorius, and all the different muscles, adductor longus, adductor magnus. So it will give muscular branches, which is not not to be mentioned. But if it's asked, what is the last branch of femoral artery? What is the last branch of femoral artery? Of course, after crossing to this opening you're seeing is called the hiatus magnus. Hiatus magnus. So after this, coming out through this, it will not be a femoral artery anymore. Now it will be called popliteal artery, right? So that means the last branch of femoral artery will be given in the adductor canal. And which artery is that? So that is called the descending genicular artery. This branch is called the descending genicular artery. Descending genicular artery, uh, it's like this. This is called, you know, descending, less of space is there. Descending genicular artery. This is descending genicular artery. But before it comes out to this hiatus, it gives another branch, and it gives a branch which runs along. Remember, one of the contents of Hunter's canal is saphenous nerve. Saphenous nerve also runs with this canal. So it is this artery, which is branch of descending genicular artery, which runs along with this saphenous nerve. So this artery is called saphenous artery. This is called saphenous artery. So you've got to know the saphenous, great saphenous, less saphenous, veins भी होती हैं, nerve होती है. By the way, saphenous nerve is a branch of, any guesses? Saphenous nerve is a branch of posterior division of femoral nerve. याद रखना, and it's the only cutaneous branch arising from the posterior division of femoral nerve. Okay. So and abhi kya hai? Artery. You got to know about the artery also, saphenous artery. It's a branch of descending genicular artery, and descending genicular artery, it itself is a branch of femoral artery, and it's a last branch of femoral artery. So many of important points I have covered up here in this first question. It might be taking long, but this will really help you for revising. Now back to the question. Question says branches of femoral artery or all except the funda femoris. बिल्कुल सही बात है. Deep circumflex iliac. This is not a branch of femoral artery. Superficial epigastric descending genicular. I have taught you all. So the answer here will be B. Deep circumflex iliac artery, which is actually a branch of external iliac. Okay. Now let's move to next question. Question number two. Question number two is superior surface of the shaft of. Question number two is uh, question number two is superior surface of shaft of first rib lodges all except. Let me rub this so it becomes clear. Okay, wait. Okay, so just clean now. Superior surface of the shaft of first rib lodges all except. So this is about the first rib, subclavian artery, upper trunk of brachial plexus, subclavian vein, lower trunk of brachial plexus. I know many of you must be knowing the answer, so no need of excitement. This is just this is topic. I'm doing is to make you learn. For those who don't know, so let's see that this is the first rib. This is how the first rib is. This is the cartilaginous portion, and here it is this sternum. By the way, this joint is chondroesternal joint. What is this point? Costochondral joint. So costochondral, all of them, remember, they are primary cartilaginous joints. And what about the chondro sternal joint? First of all, they are not present in all the ribs, only in the true ribs. So 1 to 7 you will find chondrosternal joints, and out of those 7 joints you will find that only the first one has fused. So remember, the first cause chondrosternal joint is a primary cartilaginous joint, and the remaining 2 to 6 chondrosternal joints would be plain synovial joints. Okay. Now, onto this inner margin of the first rib, you find is a protuberance, right? This protuberance here is called scalenate tubercle, and onto which there is attachment of the scalenus anterior. Okay. And here on this, there will be this groove for this vein. Actually, this vein is running anteriorly to the scalenate tubercle, and this is subclavian vein. And behind to that is this passage. Oh, sorry, this is artery. So this is the next thing that is going on here is this. Yes, so this is subclavian artery. Subclavian artery, because of this, first rib, it is divided, there is this muscle again, so don't confuse. This muscle here is coming right from the transverse processes of the cervical vertebrae down below. This muscle is which muscle? This is ischius anterior. This is ischius anterior. Okay, so scalenus anterior is descending like this. Now remember what significance about this scalenus anterior. First of all, the important point is that it is this muscle that divides subclavian artery into 3 parts, right? So the parts of subclavian artery will be 1, 2, and 3, right? So first, second, and third branches of the subclavian artery, they've been divided according to this scalenus anterior muscle. And the moment the subclavian artery crosses the outer border of this first rib, now it gets a different name and it's called axillary artery. So got it now? And let me ask you further, if this trace this axillary artery, this will further in its course will be called brachial artery. Now, who will tell me that from at what point the axillary artery continues as brachial artery? Any guesses? So remember that this is going to change when it will be crossed by this. Sorry. You should consider that this is going behind. Actually, it is forming the posterior wall of the axilla, and this muscle is teres major, right? And this artery will be running over to this, right? So after to this, after this axillary artery crosses this teres major, now it is called brachial artery, right? Now, where does brachial artery terminally divides into 2 branches? Let's say it's dividing into 2 branches. Yes, so it's branching into 2 branches. Where is happening? So brachial artery, now remember where it is branching at this level, or you can make it remember like this. Yeah, here like this. So remember, it is this radial tubercle below to this, uh, uh, or you can say better to that, uh, the neck of radius. The neck of radius. So this is head of radius, neck, and the radial tuberosity. So the level of bifurcation of this brachial artery will be along the neck of radius or just little above to the radial tubercle, um, or radial tuberosity. Then the another important point is which artery is the continuation of brachial artery, radial artery or ulnar artery? Means ulnar artery. Remember, ulnar artery is the continuation, right? It's a continuation of brachial artery. And what about radial artery? Radial artery is a miniature branch or minor branch of brachial artery. So, ulnar artery is a deep artery with a wider caliber and it's the main blood supply of the forearm as well as of palm. Remember that superficial palmar arch is a continuation of ulnar artery. Okay. So, now about the upper rib, right? First rib, the attachments, right? So, remember now behind to this uh, subclavian artery on the upper surface you find is another point of attachment of this muscle, and this muscle is scalenus medius. This is scalenus medius muscle. Okay, this is scalenus medius. So there's a gap between scalenus anterior and scalenus medius, like a passage, right? So through this passage, the roots of brachial plexus actually, when they join, they form trunks. So it's the trunks of brachial plexuses that arise from between the two. There is less of space. I mean, there's a gap. Yeah, okay, it's good. So you're seeing that there are three trunks of brachial plexus. This is upper trunk, this is middle trunk, and this is the lower trunk of brachial plexus. So the three trunks of brachial plexus emerge from between scalenus anterior and scalenus medius. And what else is emerging from between the two muscles is subclavian artery also. Got it? And an important point is all of this is covered by a layer of deep fascia of the neck, fascia culi, remember? So, what is this modification of the deep cervical fascia called, which is investing these muscles from the front? So, this fascia is pre sorry वहाँ पे I mean यहाँ पे लिखना is less of space there, so I should write something in between here. This fascia is prevertebral prevertebral fascia. This is prevertebral fascia. So how will these structures emerge down when they discover the prevertebral fascia? So what happens is that this prevertebral fascia, instead of these, piercing, these structures do not pierce the actually prevertebral fascia. Rather, these structures, like the trunks of brachial plexus and the subclavian artery, will carry the sheath along with them. Now what happens that this is like a continuation of prevertebral fascia along the brachial plexus and the axillary artery. And what is this called? Axillary sheath. So remember, axillary sheath is the continuation of प्रीवर्टिब्रल fascia. ठीक है, इसको सर्वाइको एक्सिलरी कैनाल भी कहते हैं. इट्स ऑल्सो कॉल्ड सर्वाइको एक्सिलरी कैनाल formed by axillary sheath. Okay, yes, one more important point before I move further from this question. That is, well, the question one sign, like in all Indian Institute of Medical Sciences, Delhi, that what is that nerve that descends onto the anterior surface of scalenus anterior and reaches into the thorax? So remember that there is this nerve descends onto the anterior surface of this scalenus anterior, of course, which is covered by this fascia from above. So it will, of course, pierce this fascia and will now descend down into the thorax. So, which nerve is this? This nerve is. Which nerve is this? This is phrenic nerve. Remember, phrenic nerve is a branch from C3, C3, C4, C5, right? C3, C4, C5. So it's a branch from both cervical and brachial plexus. And when it descends down into this thoracic cavity, it will be accompanied by this, first branch, first part of subclavian gives this branch internal thoracic artery. And before the internal thoracic artery descends down, it gives its branch here, which runs along with this phrenic nerve. So which artery is this which is accompanying phrenic nerve? Before the phrenic nerve enters into the thoracic cavity, this artery here is this artery here is must this is no this artery is pericardiophonic artery. This is pericardiophonic artery, right? So remember that phrenic nerve, and what, by the way, which it descends down superior mediastinum, so cross ho jayega. Then what about it runs in anterior, middle or posterior mediastinum? So it runs or anchors itself onto the right, fibrous pericardium. So it's a content of middle mediastinum, both phrenic nerve and and this pericardiophonic artery, they run together onto the surface of fibrous pericardium on both the sides, right and left. Okay, so that was about this question. I hope you got the answer now. Answer will be superior surface of the shaft of first rib lodges all except subclavian artery. You have seen it here in the diagram. Subclavian vein also you've seen. Lower trunk of brachial plexus also you have seen. This is lower trunk of brachial plexus, right? So what will be, the answer will be superior, so the upper trunk of brachial plexus. Upper trunk of brachial plexus does not lodge, rests over the first rib. Okay, so that was about question number 2. Next question. I think सब दिख रहा है ना? Question number 3. Contents of spermatic cord are all except. Let me rub all this now. Okay. Question number 3. Contents of spermatic cord are all except. So I'm going to draw a TS, transverse section of a spermatic cord, right? Now the spermatic cord has different layers, right? While it is, you know, it's running through this inguinal canal from the deep inguinal ring, obliquely ring down and into reaching the superficial inguinal opening and then descending down in the scrotum, right? So there will be different layers accompanying along, as it will move like from deep to superficial inguinal ring and then emerging out, there will be more and more of layers overlapping to it, right? So the external most layer of to this is this called external cremastic fascia. Now, external cremastic fascia is actually an extension of the aponeurosis of external oblique aponeurosis. Okay? So, external oblique aponeurosis extends as external cremastic fascia. Then, deep below down is another fascia, and this fascia, you know, the external cremastic fascia that I told you, this fascia you will find covering the spermatic cord only when it emerges out from the superficial superficial inguinal ring. So from superficial inguinal ring down below it, you will find this external cremastic fascia. Now what you're seeing here, this is internal cremastic fascia. Now, internal cremastic fascia is actually extension of fascia transversalis. Fascia transversalis, remember? So fascia transversalis is deeper to the transversus abdominis, right? And it is coming right from the deep inguinal ring, right? So this internal cremastic fascia, it will be coming from deep inguinal ring and will be covering the entire length of spermatic cord. So another important point it is that you will find this along the entire length of spermatic cord. So it can be another MCQ sometime. Remember, they'll give you a list of long so many layers. There will be cremastic layer as well. So remember that this is an important point, that this layer, internal cremastic fascia, you will find along the entire length of the spermatic cord. By the way, in between these two, you will find is like meshwork or the smooth muscle fibers, they're having a lot of spaces in between, because this is like extension of the two muscles in between. What are the two muscles? So this is actually cremastic muscle, cremaster cremaster muscle, you can say cremaster muscle is here, right? The cremaster muscle actually is a mingling of those smooth muscle fibers within the loose areolar connective tissue. So it's a loose bag of muscles, and this is a continuation of internal oblique abdominis plus transversus abdominis muscle, right? Now, where will you find this? Of course, below or at the lower limit of these muscles. So, where you find the lower limit of these muscles, of course, remember these two were forming the conjoint tendon, also forming, the roof and the posterior wall of the inguinal canal medially. Then, you can say at the median of the inguinal canal, from there you find that cremaster begins to form. So, this also we will not find in the entire length of the spermatic cord. Now we'll focus upon the contents deep inside, like in the inside. This content here is very important content. It is called the vast difference. Vast difference. Now, vast difference is like the ejaculatory system or the ejaculatory system, and this will be having an approximately placed in artery, and this will be, what will be this? This will be artery to vas difference. Artery to vas difference, by the way, it's a branch of, who will tell? Artery to difference is a branch of superior vesicular, artery, and superior vesicular artery is a branch of anterior division of internal iliac. By the way, any other important point, anybody remembers about the superior vesicular artery? Yes, it is what? During the fetal circulation, this umbilical artery was nothing but a continuation of the same. It actually is a remnant of the posterior, the proximal end of this umbilical artery. Umbilical artery was actually continuation of this superior vesicular artery in the embryonic period. Okay, so that is about the umbilical artery. And yes, so this artery will have a plexus surrounding this, sympathetic plexus, of nerves. They will surround this um, artery to ductus deferens. There will be a gonadal artery, very important artery. This is a direct branch from abdominal aorta, and that is called testicular artery. Testicular artery you will find there. And you will also find artery to cremaster. Artery to cremaster will also be seen here running between, like, of course, it has to supply this cremaster. So you will find here is artery to cremaster. And who will tell me that artery to cremaster is a branch of? If you were focused, I told you in question number 1. Got it? Just have a look. Can you see now? Artery to cremaster. Yes. This is artery. Let me use a different color so that I can highlight this. This artery I told you. कुछ याद आ रहा है? Yes, this is artery to cremaster. So what? Artery to cremaster is a branch of inferior epigastric artery, which comes out through the deep inguinal ring and then continues within the spermatic cord. So you have got to know so much about these structures. Now this is cremastric artery. It's a branch of inferior epigastric artery. Nerves का अगर बात करें, so there will be two nerves actually. There are two nerves which are content of spermatic cord. One is the sympathetic plexus, and there will be a nerve within this, and this nerve I told you is coming from the right from the deep inguinal ring. So this is genital branch. Sorry, this is genital branch of genitofemoral nerve. So this is genital branch of genitofemoral nerve, right? One of the contents of spermatic cord. What will it supply? Of course, it will supply, remember, it will supply the internal cremasteric fascia. It will supply cremasteric muscle. It will supply external cremasteric fascia. What else? It will supply the skin of the scrotum as well. Got it? And because actually it's like the dartus also there. So that was about the genital branch of genitofemoral nerve. And what else you find in there is the venous plexus, like bag of worms. If there is varicocele of these venous plexus, scrotum appears on being felt as a bag of worms. So varicocele of this pampiniform plexus, this is Pampini, Pampini, Pampiniform plexus of veins, right? Testicular veins. So that you find is here. And don't forget, there is also lymphatics. Lymphatics also. These are lymphatics also are seen there. Lymphatics. You find these lymphatics also as a content of spermatic cord. Finally, what you do not find within this is a nerve, which is, like, remember, this nerve I have drawn outside to the spermatic cord, and this is ilioinguinal nerve. Now, ilioinguinal nerve की important point ये है कि that it is a content of inguinal canal. Ilioinguinal nerve is a content of inguinal canal, but it stays outside the spermatic cord in the inguinal canal. So when the two structures emerge from the superficial inguinal ring, you will find that this inguinal nerve, ilioinguinal nerve, it stays out to it stays out of the spermatic cord. So this was about the inguinal nerve, and of course now you've seen that you know the answer given here. What will be the answer to this question? Contents of spermatic cord are all except testicular artery, ilioinguinal nerve, branch of genitofemoral nerve, cremasteric artery. You have seen, I have taught you enough that ilioinguinal nerve stays outside the spermatic cord. Okay. The question number 4 is contents of the pudendal canal are all except superior rectal nerve, interpudendal artery, pudendal nerve, dorsal nerve of penis. So you need to know where actually pudendal canal is. Fast revision here. You can just now what I'm drawing here is internal structure, internal view of the pelvis. It's a pectinate line, right? Lesser anterior inferior iliac spine. Then you saying this is the this, right? And then here you saying is the ischiopedical ramus. And from this ramus he must be like is the isch velocity, and there is this grid, lesser sciatic nerve, greater sciatic nerve. So remember when I have completed this thing in the gluteal region, but here again I am telling you that where exactly it is located. This is the obturator foramen. So there were structures coming from the lesser sciatic notch along to this, you know, inner surface, the pelvic surface of ischiopedic ramus, and this all is covered by this opening here. It's covered by this muscle, big muscle here, and that muscle is obturator internus, which is covered by obturator fascia. So it overlies, this is covered by an investing layer of the obturator fascia. So have you got this idea where this pudendal canal is located? It is located on the inner surface, so the pelvic surface of ischiopedic ramus, and covered by this obturator fascia. So the this canal I'm going to draw here. So to explain you the contents of this presumed to be a pudendal canal, right? And now the contents here, remember this contents here will be actually, this is NaV. The formula you can remember it's like this, NaV, right? Same thing will be here, vein, right? And before that you understand that it will be like this, something like this, will be like this, right? And over here will be the inner opening, right? So the branches will be given like this, right? And three branches. Similarly, in case of the artery also, this is intralunar artery, continues that is deep artery of the penis and the posterior scrotal vessels, and the nerve, interpudendal. So this one will be the nerve, pudendal nerve, continues as the dorsal nerve of penis. And here, all of them they're giving the branches to supply the anal canal. They will be called inferior rectal nerve vessels, and this continues down as to supply the skin on the posterior two-thirds of the scrotum, that is posterior scrotal nerves. And these nerve vessels, they are also supplying the muscles there, superficial muscles in the perineum, like superficial transverse perineum, basic cavernosus, So that is about the structures passing. Just I'm just zooming it out so to have a clear idea. You see is pudendal nerve. Pudendal nerve is S2, 3, 4 ventral division from the sacral plexus. Then this pudendal nerve, while running in its course in its pudendal canal, I told you it will give out its branch to supply the anal canal, and this branch given out within the pudendal canal is called inferior rectal nerves. However, remember that it's a misnomer. Why? Because it supplies the anal canal. Then within the anal canal, it gives another nerve which emerges out then and descends down to supply the skin on the posterior two-third of the scrotum. So this will be called posterior scrotal, posterior scrotal nerve. So this perineal branch, and further it will give branches also in further also to supply the muscles of the perineal, the superficial muscles, transverse perineal, superficial, and um, corpora cavernosa, crus penis. Then the blood vessels running here, this you see is dorsal nerve of penis. Got it? Now the arteries they'll have a similar course, right? So the arteries will run along like this, right? So arteries they will also give this branch here. This will be inferior rectal artery, right? Similarly, now this will be the perineal branch. This is perineal branch to supply the muscles in the perineum. So it will also give this posterior scrotal branch, right? And it will continue further in the penis to supply the the deep structures in the penis, the corpora cavernosa, corpora spongiosum. So this they will be called as the deep arteries and veins of the penis. Deep artery of penis. Got it? So similarly will be now the vein thing. Veins also have the similar course like this. This gives this inferior rectal vein. Then this perineal branch they will also supply the scrotum. In case of females, it will be the labia majus posterior to third, or as well as now it will also reach into the penis to drain the deep structures of the penis. So it's called deep vein of penis, right? And along with the dorsal nerve penis, it will also give its branch here, and that is called dorsal vein of penis. Similarly, will be an artery, a branch to follow this dorsal nerve, and this will be dorsal artery of penis. So all these structures you are seeing they are contents of pudendal canal. So what you see is not a content of pudendal canal that has been asked in the question. So structure which is not content is superior rectal nerve. So superior rectal nerve, remember, it supplies the rectum, right? And inferior rectal nerve and vessels, they supply the anal canal. So these are misnomers. Superior rectal nerve is like the combination of both sympathetic and parasympathetic fibers. Sympathetic fibers, it's an autonomic nerve, so this sympathetic outflow will be from L1 and L2 segments, right, and the lower segments of this sympathetic outflow, and the parasympathetic, is S2, S3, S4. So together they via this, hypogastric plexus, inferior hypogastric plexus, via this aortic plexus, inferior mesenteric plexus, Ultimately, they derive this nerve called superior rectal nerve, which supplies the rectum, upper portion of the rectum. Got it now? So superior rectal nerve is not a content of pudendal canal. Now let's move to the last question. That is about derivatives of intraembryonic coelom are all except peritoneal cavity, cranial cavity, pericardial cavity, pleural cavity. So look here, like let's say this was developing foregut and midgut and hindgut. So this was a developing tube, endodermal tube forming the primitive gut, and this is the vitellointestinal duct. And if you remember, there was this, you know, pericardial cavity being formed here. A pericardial cavity was being formed here, ventrally to the upper portion of the foregut. And this cavity, the rest of this, it was surrounding by a bigger cavity from all the sides, right? This cavity was connected to the pericardial cavity by like this on both the sides. This, right? So this is how the this cavity, this is called intraembryonic coelom, right? So intraembryonic coelom forms three cavities. This is called the pericardial cavity, pericardial cavity, and this will be called the peritoneal cavity, peritoneal cavity. Okay, and now these two tubes connecting the two cavities. So this will be pericardio, peritoneal tubes or cavity. Right? What will this form? This will form pleural cavity later on. So these are the three cavities. All this is actually the lining of the embryonic mesoderm will be called mesothelial lining. So all this together actually forming the cavities, and this is like the embryo. So this is the embryo, and here you finding this is how the body cavities splits to form three cavities: pericardial, pleural, and peritoneal cavity. Now, what about this cranial cavity? Cranial cavity is actually it's derived secondarily. This brain, fetal brain, is very delicate, and that while the development of this fetal brain, there are flat bones which are formed very early in intrauterine life to cover the developing brain, and gradually the brain is enclosed by bony apparatus from all the sides, and that is called calvaria. So this uh, cranial cavity is actually formed secondarily. It's not internally, not derived from internal coelom. So the answer here will be cranial cavity. So I hope you understood all of this. This will help you revise before your exams. Okay, so I think it is done.